When most people hear the word diabetes, the focus is almost always on the pancreas. The public understanding centers on a metabolic struggle, a failure in how the body produces insulin and manages sugar. For millions of patients, daily life is defined by a meticulous routine of pricking fingers, scanning their monitors, and avoiding high glycemic foods. The entire management strategy often shrinks to keeping a single glucose reading in the safe zone. But there is a disconnect between that daily routine and the primary threat to life. Cardiovascular disease, not a diabetic coma or organ failure, is the leading cause of death for diabetics. This creates a dangerous knowledge gap. A patient who successfully stabilizes their glucose might assume the danger is gone, unaware that a silent, physical threat is still actively developing inside their arteries. To effectively manage this condition, we have to look past the metabolic side effects. At its core, diabetes acts as a deeply destructive vascular disease. To see the damage, we have to go inside the bloodstream. In a healthy body, the interior of a blood vessel is a smooth, unimpeded environment, allowing blood to circulate without resistance. Chronic high blood sugar changes the nature of glucose. It stops being a passive fuel source and begins to act as a destructive force within the vessel walls. Excess glucose molecules act like microscopic abrasives. Over time, they relentlessly scrape, scar, and erode the delicate inner lining that keeps our blood vessels flexible and healthy. The body responds to this structural damage with inflammation. The vessel walls become swollen and biologically sticky. This inflamed environment starts to trap passing cholesterol and fatty deposits. Instead of moving on, these fats lodge deeply into the artery walls. This is atherosclerosis. Trapped deposits harden into rigid plaques that grow over time, physically choking off the opening of the artery. This mechanism is essentially a self-inflicted plumbing failure. It starves vital organs of oxygen-rich blood, creating the physical conditions that lead to heart attacks and strokes. Zooming out from the microscopic view, we see that this vascular damage rarely happens in a vacuum. For many patients, the risk is systemic. When other conditions are present, they act as accelerants, compounding the damage and speeding up the buildup of plaque. High blood pressure introduces a mechanical stressor. It forces blood against those already narrowed and weakened vessel walls, like fluid moving through a failing, pressurized pipe. Other factors like abnormal cholesterol, obesity, and physical inactivity act as a supply chain, continually dumping the raw fats into the bloodstream that feed these blockages. Smoking adds a final layer of chemical stress. It introduces toxins that further degrade the already fragile vessel linings, making it even harder for the body to repair the damage. A patient with unmanaged comorbidities is caught in a deadly, escalating feedback loop. Without intervention, these factors continue to stack, making a major cardiovascular event the most likely outcome of the disease. Mapping out this microscopic process changes the focus of treatment. It moves the priority from simply reacting to a number on a screen to actively protecting the body's internal architecture. Because the progression of atherosclerosis follows such a direct biological path, intervening at any step of the cascade can stop the damage from advancing. The first line of defense is aggressive blood sugar control. By keeping glucose stable, you stop the initial scraping and inflammation that makes the vessel walls sticky in the first place. Managing blood pressure and cholesterol forms a secondary shield. This removes the mechanical pressure on the arteries and starves existing plaques of the fatty building blocks they need to grow. Lifestyle choices like regular exercise and a heart-healthy diet contribute to the same goal, stabilizing the cardiovascular system and allowing the body to maintain clear, flexible vessels. Protecting your blood sugar is no longer just about managing a metabolic condition. It is the most direct, proactive step you can take to safeguard your heart for the years ahead.